Southside of Chicago is a very large community. There's roughly about 900,000 people who live on the South Side. They vary in income from $10,000 a year for a family of four up to $200,000+ for a family of four. Children on the South Side of Chicago have a prevalence rate of asthma at about 17% compared to 9% across the country. There are communities on the South Side of Chicago where 59% of the kids have asthma and miss school on a regular basis because of asthma or end up in the emergency departments across the South Side of Chicago because of asthma conditions.
It means missed days off of work for the parents, missed days of school for the child, and really can bring an economic issue to the community because of all of those. And we have actually higher death rates due to asthma in our children. Losing a child too young to something that we can prevent is something that affects all of us.
Hey, hi, how are you guys doing?
Asthma is an inflammatory disease of the airways, or the breathing tubes of the lungs. It can cause permanent changes in those airways if left untreated. So with early treatment, we can have better outcomes. We at Comer Children's Hospital Asthma Center and the University of Chicago Medicine are working to bring improved care to asthma in the community itself as a community effort to reduce this asthma epidemic that we are currently in.
We do things from sharing the data and information on asthma in our community. We develop programs together to treat asthma and to care for persons with asthma.
We're working with Respiratory Health Association, the Chicago Asthma Consortium, Urban Health Initiative, Larabita Children's Hospital, and Friends Family Health Center, to name but a few. The University of Chicago Medicine, Comer Children's Hospital Asthma Center, has 4 pillars of excellence. The first pillar is clinical, both inpatient and outpatient reach. The second pillar is education, bringing education not only to the child, but to the family, the community, and other healthcare providers. The third pillar is our community outreach and our community partnerships, especially with the schools and churches, to not only provide clinical care, but education, and to bring back knowledge translation. The fourth pillar is that knowledge translation or research, so that we can improve asthma care, diagnosis, and treatment down the line.
In the South Side of Chicago, we have been able to work with the mobile medical unit, and we have been able to go to the Chicago Public Schools to help educate family and students, as well as to attend church events and health fairs to educate them as well. I truly love being able to teach parents and children the appropriate medications, making them aware of what the signs and symptoms of asthma are, how to treat them, and getting them to be able to identify and get treatment appropriately.
The research that we're doing in the schools in Chicago centers around working with schools to identify best practices and resources to help implement existing policies and new models of care so that children with asthma have the best quality of life and education throughout their school years. An example of research we're doing in terms of a specific project is starting at the beginning. We need to actually identify children who have asthma to best provide the policies, the programs, and the resources so they can get that optimal care. And what we truly hope to develop are pragmatic evidence-based models so that kids with asthma have the same experiences in school that those without asthma do.
So these are both your pumps, right?
Yes.
Okay.
I have a one child at a time philosophy for asthma management. My belief is that when you change the life for that one child, they're able to play, they're able to go to school, they're not hospitalized. So not only have you impacted the quality of life for that one child, but they'll now go and tell their friends, hey, my asthma's under great control. And their friends will sit there and say, hey, I want my asthma under great control. And they'll talk to their parents and it'll come back.
Comer Children's Asthma Center, it's a great development for the community, because what it is doing is trading on the strengths of the university, which is collaboration. And this pulls in people from multiple disciplines and is intended to work through the community and to increase and improve the outcome for children while integrating the community with the powerful research and clinical care that takes place at Coma Children's Hospital.